participants are muted except for the presenters. And I would like to remind everyone that this is recorded, so please make sure that you are unmuted and your cell phone and other sound making devices are muted. During question and answer session, after all the presentations, you can use the raise hand button. You can find it under the participants, find your name and click on the right click. You will find the option to click on raise hand. Yeah, we will call on you to ask your question verbally according to the list of people who have raised your hands. So there is going to be a poll, and please fill out the poll, and it's anonymous because we just want to know who attend the FKP. The slides can be found at the Google Drive. The address is listed on your screen. Please make sure you write FKP in capital letters. We also thank the ANU Indonesia project and the Australian Department of Foreign Affairs and Trade for supporting this FKP Secretariat. And this event is a collaboration with the Indonesia Regional Science Association and with the Forum Kajian Pembangunan. Thank you, everyone. And may I introduce Dr. Dewi, who will be chairing the session. Please, Ibu Dewi.
Okay. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Okay, without further ado, I would like to explain about the book series. This is the book series number 18 from IRSA, Indonesia Regional Science Association conference that held in Banda Aceh in 2019 on 22nd until 23 July at Hermes Paris Hotel. So the book consists of selected papers from the conference. That the book is edited by P.S. Nazamuddin, Pak Nazamuddin, Saiful Mahdi, myself, Dewi, Pak Saleh and Saleh Safi'i, Alin Halimatus Sadiah, Pak Joni Hartono, Pak Devanto Pratomo, Hefrizal Hendra, and Pak Budi Peresos Belmo. So the theme of the conference was disasters and regional development, and the conference was conducted by IRSA in collaboration with Faculty of Economics and Business UNSIA and Research and Training Center for Social Science and Humanities PPISB, and the Tsunami Disaster Mitigation Center TDMRC and at Universitas Kuala. And also with Aceh International Center for Aceh and Indian Ocean Studies, and last Aceh Regional Development Planning Agency, Bapeda. So I'm myself from ICAIOS and also from Syiah. ICAIOS is a joint international center between UNSIA, UNR Anariri, and Malikul Saleh, and also supported by local government of Aceh. So without further ado, we start our book launch by Professor Arief Ansori, the President of IRSA and Padjadjaran University. Time and place are used, Pak, around 5 minutes.
Thank you, Bu Dewi. First of all, I'm quite happy this morning because I can say hi to many of my friends, long friends, close friends, sahabat-sahabat semua, ya. Because for so many months, yeah, we haven't seen each other for a while. And also, first of all, I would like to thank the organizers of this event. Of course, our beloved partner, Australian National University, particularly Indonesia project that hosts this special Forum Kajian Pembangunan seminar to launch our book. And then maybe the most important one, of course, I would like to appreciate the kegigihan, the persistence of all the book editors and the book writers. I would like to thank the book writers first because I know that congratulate first, because this is, I think, it's very selected, yeah, very selected, and then of course after edited, yeah, reviewed by uh, colleagues, editors, yeah, Pak Najmuddin especially, yeah, and friends in Aceh, and also other Pak Budi Resosdarmo dan kawan-kawan yang lain. It become like one of the most high quality publication in the country. I think the quality of this book is a lot higher, even not a lot higher, maybe 10, 100 times higher with common journals that we normally submit. Yeah? Many Indonesian docents submit. I think this is very good quality articles. So this is a result of our like our maintain of the principles that we want to keep the quality of our publication, and of course the persistence, quality and persistence. Yeah. So I would like to appreciate all of us here, and hopefully this special setting, unlike many previous years before, where won't prevent us from being proud of having IRSA, yeah, as in our community, and also having this publication. I learned that even though this kind of trouble may make some of us, like not really happy. However, I learned that, of course, from economic theory too, yeah, that normally generations that can pass through troubles normally come out as champions. So I believe that it will happen to us like this too. So without further ado, so I think my role now is just to officially launch the book. So herewith, with Bismillahirrahmanirrahim, yeah, I would like to launch our IRSA book series, development on regional development number 18, disasters and regional development in Indonesia. Thank you so much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Pak Arief.
Waalaikumsalam warahmatullahi wabarakatuh.
Because of pandemic, we have a virtual book launch and we have also virtual reunion. So we feel also good that can boost our immunity, I hope. So without further ado, we also move to the next agenda. There will be two papers from the books will be presented in this book launch. First of all, the impact of disaster on mental health, the case of 2006 Yogyakarta earthquake. These chapters was written by our colleagues from University of Gadjah Mada University, Ibu Mustika Septiyas Trisilia, Bapak Catur Sugiyanto, and Ibu Diana Setiyawati. So without further ado, 20 minutes, time and place are yours. Ibu Mustika, who will going to present first? Ibu Diana?
Yeah.
I
will.
Silahkan, Ibu.
Yeah, I will share my screen. Okay. Is it already on the screen? Can you see my screen? My PowerPoint?
Yes, we can clearly see.
Okay. Assalamualaikum warahmatullahi wabarakatuh. On behalf of Mustika and Prof. Catur, on behalf of Mustika and Prof. Catur, I would like to present this paper, The Impact of Disaster on Mental Health, the case of the 2006 Yogyakarta earthquake. So, we do understand that we are in this country living like prone of disaster, earthquake, tsunami, volcanoes, everything. And back to 2006, Yogyakarta earthquake killed more than 5,700 people, injured 40,000 to 60,000 people, destroy hundreds of thousands of homes, and rob community livelihood. Loss due to the earthquake were estimated 29.1 trillion. It's huge that time, very hard. And uh, research on disaster is actually very difficult, yeah, because we usually doesn't have baseline, and all the disaster is unexpected. Also, the ethic of the situation, yeah, the ethic make the situation difficult to investigate it. So in this research, we are using the IFLS data. So individual exposed to hazard are prone to PTSD, depression, and other mental disorders. That according to literature. Yeah, and disaster do not only affect mental health in less than 1 year, but could be even more, having effect on mid and longer term. Yeah, we will discuss later. So what the condition, yeah, what make the condition difference between one survivor and others is the prior condition, the person's resilient, reasonable prevention effort, adverse addictive of effect, and a significant factor of reviving stress. Previous studies on the impact of disaster on mental health focus solely on respondents and areas affected by high exposure of disaster. However, there is a possibility of unobserved heterogeneity. For example, the higher level of destruction and causalties occurs to victim. Lower house quality indicates less well-off condition in which the mental condition of the community are usually worse. There is a possibility of further psychological impact in more than 1 year, such as PTSD, depression condition, considering the Indonesian is a disaster-prone country in which survivor will experience repeated trauma, and also because of the complex determinant of mental health. So there are complex social determinants of mental health. Okay, we will discuss about this the data first. So the sample extracted from Indonesian Family Life Survey data for with 3 IFLS 3 2000. We assume it is as a precondition, and wave 4 is IFLS 2007-2008, and so post disaster, and then wave 5 and our IFLS 5 as a repeated measure 2014-2015. Individuals age the subject is individual age 15 to 70 years in 2000. So on the 2000, when before the earthquake, already 15 years up. Live in Bantul before, during, and after the 2000 Yogyakarta earthquake, 2000 to 2014, and experienced the 2006 Yogyakarta earthquake. Yeah. So from this criteria, we do have the 675 individuals from the first wave, and 751 from second wave, 804 individuals from third wave. But the one that match the inclusion criteria, that they are living in the Bantul and also experiencing earthquake. There was a question about whether you experience disaster in the last 5 years or not. So we from that we got 393 individuals, the same individuals from 2000, 2007, and 2014, and that's the profile of the samples, and then we use the CEDS, the mental health, to score the mental health. So the the summary, or the result from this analysis is that shock or direct exposure to this disaster increase score of survivors mental disorder. So increase the likelihood to have that score of mental disorder, but doesn't cause of depressive symptom, because depressive to be diagnosed to be depression, the participant have to reach a certain score, and also then after that need to be rechecked by the clinician. And but for this condition, they doesn't cause depressive symptom. So the condition overall is low average of mental disorder score in Bantul before the earthquake. So the pre-post, and Yogyakarta reasonably high happiness index. So that one is maybe the one also the reason why this data is like that. And then 8 years after 2006 Yogyakarta earthquake, and we assume there are other disaster, 2010 Merapi eruption, the direct exposure of 2006 earthquake decrease score of survival mental disorder. Proof that the prior disaster experience can be used as reasonable prevention effort and building the survivor resilience. So from this result, the explanation from psychological point of view may be like that. That in the first year, we can say that it is short term. There are the normal reaction to abnormal situation instead of trauma in the condition of if anyone experiencing such extreme event like disaster. So the affected communities usually have difficulty in terms of planning, decision making, setting priorities, anticipating future needs, even feeling numb, shocked, confused, are not sure of their future. Emotional reaction might also delay displays of things that less important. And also sometimes difficulty in remembering thinking can also occur. But that one, we don't call it trauma. Maybe for us 1 month, it is still normal. So we call it normal reaction to abnormal situation, while the people in the media, for example, they will call it trauma. But basically what the condition is normal reaction to abnormal situation. So everything just normal. Everyone, if they are experiencing or going through the kind of condition, they will having a kind of this condition. And medium term will be like sometimes persist or persistent. But in the long term, adults and children can feel being isolated from friends and family, caused by catastrophic consequences that are long and sometimes not being understood. So the common issues after disaster is economic hardship, decrease in quality of life, health, and trauma. And that's make what we call a social determinant of mental health. The community experience changes, sometimes displays difference in the family member and do not feel the similarities as before. Many of the social, marriage, family problems that delay appear of and culminate in a crisis. On the contrary, the experience of the disaster can also provide new understanding, increase wisdom, positive priorities change, and development of strength facing stress, which can help them later in life, make them stronger, like what we got from the repeated measure 2014 IFLS. That's the vulnerable group, children, elderly, individual, and also poverty in the low social economic. So we do have something like this disability, mental health problem, poverty, and uncontagious disease is basically non-communicable disease, we call it in the health system. So we can start from everywhere. We can start from here, for example. Say if mental health disaster make mental health problem or cause mental health problem in individuals, then they will lead to disability. Mental health problem is something that having high years of disability number. Yeah, so other health problem like cancer will not have years of disability because the mortality rate is high. But for mental health, such as depression, the years lived with disability is high, meaning that depression can make the person who's suffering from that disabled for a long time. So it can make disability, and then disability, because of the disability, they can work, they can be productive, and then lead to poverty, and poverty lead to low quality of food, everything, then making a non-communicable disease. Or we can start from disability. Disaster can make disability. We understand that so many people disabled due to the 2006 disaster in Bantul. They have to live forever with wheelchair, for example. So disability can lead to poverty or can lead to mental health problem, and then lead to poverty and non-communicable disease, or poverty because of they don't have or they lost their job after the disaster. Poverty can lead to mental health problem, depression, or can lead to non-communicable disease, and then making them depression, for example, mental health problem, and then lead to disability. So that's four things, kind of a change that interconnected. So it is something out of the paper, but the key recovery basically for the disaster thing is the comprehensive mental health system. So what we need is not putting all the money for kind of psychological support for the short term impact, because what happening in the short term things is actually a normal reaction to abnormal situation, and what they need is basically the basic need. If we can ensure they get the basic need, back to routine, back to school soon, everything, they will maintain their mental health. So the wise thing to spend for disaster management is the focus on the middle and in terms of mental health, I mean, focus on the middle and long term. For the short term, it is enough to give them what we call psychological first aid that can be delivered by anyone who being trained, and it is easy to train them for that. But for the long term, the key things is we need to strengthen mental health system in primary level. Because the impact of disaster can be long term, like what we said before. So primary healthcare, we will see many impact on the primary healthcare, the mental health problem on primary healthcare, according to literature, as an impact of disaster. Then we need to strengthen family resilience, because family is always the backbone of well-being of the people, and then building a school-based mental health system, because the impact of the disaster in terms of mental health for long-term in the long term can shown in school or in primary care level. For example, they lost their parents, the changing in family members, or sometimes the parents less need to working more harder because of the poverty, something like that. So the children get impact in the long term. Yeah, that's I think that one is the what we can present. Maybe later Mustika and Prof. Catur can add some point. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Warahmatullahi wabarakatuh. Thank you, Bu Diana. You still have like 3 minutes. Others want to add to what Bu Diana has been presented?
Prof. Catur.
Yeah,
Prof. Catur. Yeah.
Thank you. I just want to add a little bit that what Diana presented. And there is also a story where people who are taken out of the disaster influence areas have longer traumatic problem than those who stay at the area. This might be because, feeling much more reality compared to staying away from the ruined house and keep thinking of them. Maybe it's worse than, staying at the area together with the neighbor. They're able to work together to, build up their home and together and so on. That's might be people get relief faster compared to those who are staying away. I think that's representing, the high score of happiness living in Bantul. Maybe that might be different from what happened in Aceh, where people just gone. Because of the disaster. So that's might also explain why there's only very small cases people have some traumatic after disaster. Thank you. That's what I have.
I think that quite same experience here as well in Aceh.
Yep.
Okay, thank you, Ibu Diana, Pak Catur for the paper. And then we move to the next paper. The second one will be presented by Muhammad Mulia, Bapak Muhammad Mulia, Pak Amirusholihin, Pak Edy Purwanto from Lembaga Survei Meter. The title is Comparative Analysis of Healthcare Service Quality Across Regions in Indonesia. So both papers are quite related, talking about health. Yeah. Okay, time and place are yours, Pak. 20 minutes. Who is going to present? Pak Amir? Atau Pak Edy ada masalah dengan speakernya, Pak? Pak Edy dulu.
Mulia yang.
Oh ya, oke, good.
Mulia.
Saya dengar kamu. Silakan, Pak.
Yes. Pak Mulia will be presented. Pak Mulia, Bu, yang will be presented. Please unmute.
Pak Mulia. Ya, Pak Mulia masih unmute, Pak.
Muhammad Mulia will be presented.
Coba, Pak. Sekarang bisa, Pak?
Please unmute.
Pak Mulia Muhammad, boleh?
Yes.
Coba.
Yes.
Pak Mulia bisa dengar saya?
Yes.
Ya.
Okay. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Thank you for the opportunity to present our paper. Our paper, the title is Comparative Analysis of Healthcare Service Quality Across Regions in Indonesia. First, I would like to introduce our team. I am Muhammad Mulia, Edy Purwanto. We are in Yogyakarta,
Turn
and
off
then
on your cell phone because there is a apa gaung ya, ada gaung. Usually it's because do you have the connection with the cell phone on as well? Two connections if there is gaung.
okay. Okay. Now, it's clear.
Yeah, yeah. Now good, Pak.
Okay. Next, I will start a presentation with the study background. Then we'll present data and method, followed by some findings and result, and finally a conclusion and policy implication. Okay. I will start with the question: why this paper focus on patient satisfaction? Health facilities are required to provide quality health service.
Maaf, Bapak,
Yes.
do you have a share screen?
Yes.
Can you share your screen? Yeah, yeah, we can see your screen now. Yeah.
Okay, I will start with the question. Why this paper focus on patient satisfaction? Health facilities are required to provide quality health services. Quality of health service can be assessed from the level of individual satisfaction after they use facilities. Modern health practices put more focus importance of patient perception and satisfaction toward them. Therefore, healthcare provider focus on products and quality to meet user satisfaction. Based on this explanation, patient satisfaction is the main indicator of quality health service. Patient satisfaction is an important indicator in measuring the quality of healthcare. How is patient satisfaction in Indonesia? Satisfaction research has been carried out several times in Indonesia. The research show that patient satisfaction is affected by type of facilities, service, element, distance, waiting times, maintenance costs, and province. Patient satisfaction is also affected by health service, especially in the communication relationship between patients and service providers, facilities, and information retrieved. Study from Bernhard 1999. Several other studies examine patient satisfaction at the health facility level, like a study from Kartika 2018, study from Sugiyanto 1917, study Dana 1917, and Passeringhi et al. 1915. But we find that they didn't include patient characteristics in their estimates model or their analysis. Even though individual satisfaction is influenced by several factors from the characteristics of the individual itself, based on from Ver 1983, Linda Peirce 1982, and Donabedian 1980. Well, the research question is, what are the determinants of patient satisfaction toward health service by comparing various type of health facility in several regions in Indonesia. So this study aims to assess quality of health facility in different regions in Indonesia by analyzing patient satisfaction. Why is the research question relevant? Because Indonesian has large area and each region has different characteristics. The level of development progress in each region is different. And individual characteristics in each region is different. And various type of health facility in several regions in Indonesia. What is the research gap? Unlike previous research, this chapter, our paper will include 2 points, individual characteristics in the estimation model. Number 2, the division of region is based on proximity of the region and the distribution of development. Now let's move on slide data and method. Amir, time is yours, Amir.
Okay, thank you, Pak Mulia. And I will present the data and method. This paper used data from Indonesian Family Life Survey Web 5. And the sample we use is adult who had visited outpatient care in several health facilities. Each person will be asked whether they are satisfied or not with the services provided. From the criteria, the total estimation number is 4,777 individual. And this is the estimation model. We built the estimation model with the 3 variables. Health facilities is a type of health facilities in Indonesia. Service, cover individual distance with health facilities and waiting time for obtaining service. And demographic is a characteristic of outpatient. From the model, we will compare in 3 regions. Region 1 is Sumatra, Region 2 is Jawa and Bali, and Region 3, Kalimantan, Sulawesi, and Nusa Tenggara. We will estimate the model with the profit regression, and we need to look the marginal effect from the profit regression to determine how much the X variable affect the level of patient satisfaction. Next, please. This is a level of patient satisfaction in each region. In region 1, 79% patients were satisfied, and region 2, 83% patients were satisfied, and region 3, 82% patients were satisfied. So from the data, we know that the region 1, the lower is a lower satisfaction where we compare with the other. Next, please. This is a level of patient satisfaction in its health facilities. 88 patients in nurse and midwife were satisfied, and 87 patients in private physician were satisfied. And then the lower satisfaction in the data is a public hospital. The percent of patient satisfaction toward nurse and midwife is higher among all facilities, and the second higher is toward private physician. Next, please. We tried to compare data before, and this is a patient satisfaction in health facility by region. The highest level of patient satisfaction is found toward nurse and midwife in region 1, about 87%, and in region 2, about 89%. What about the region 3? In region 3, the highest satisfaction is found toward the private physician, about 92%. And the next, Pak Edy will be explain about the factor that the affect patient satisfaction. Pak Edy, and yours.
Okay, thank you, Pak Mulia and Pak Amir. Next slide, Pak Mulia. Ladies and gentlemen, I will continue to the next part. Now we will discuss about the profit regression result. The first result is on the type of health facility. From the result of the marginal effect, we can see that the private physician and nurse midwife have the highest score for all regions. The value range from 0.13 to 0.17. They show that the probability of satisfaction of patients who go to the private physician and nurse midwife is 13 to 17% higher than the benchmark with the public health center. With value ranging from minus 0.16 to minus 0.01. So, by type of facility, private physician and nurse midwife provide the highest satisfaction. This result support the previous finding, which state that the private physician and nurse midwife give the highest satisfaction. Next slide, Pak Mulia. And we try to figure out the reason why private physician and nurse midwife give the highest satisfaction. We look at but the result didn't seem to explain the finding. From availability of device and level cleanliness, we found that number one, across the region, the mostly only have inspection desk and trash bin. And two, data from region shown that the health facility have proper hygiene, seen floor and wall. But we could not tell the proper hygiene was one of the reasons. So, based on Bernadette 1999, we assume that patient satisfaction may result from good communication between patient and service provider. Next slide, Pak Mulia. Thanks. Now, let's discuss group of variable 2 and 3, service and demographic. For service, 15-minute waiting variable give negative effect to patient satisfaction with minus 0.04 to minus 0.08. They show that waiting time more than 15 minutes has lower probability of satisfaction by 4 to 8% point. For demographic, see older age group is positive significant with satisfaction. Is most region, the significant is 0.06 to 0.08. This means age more than 46 has a higher probability of satisfaction rate by 6 to 8% point. Opposite that, age less than 30 has lower probability of satisfaction rate by 4% point compared to benchmark group, which is age 30 to 45 years. Next slide, Pak Mulia. Next slide. Okay, thanks. Then it It is waiting time graphic. The graphic show average time of its facilities in all region. It shows that in all region, private physician and nurse midwife have average waiting time of 3 to 15 minutes. This marks a lower time than average waiting time in public hospital, which is 12 to 19 minutes. This support that previous finding that the length of waiting time is in line with the level of patient satisfaction. Facilities that have a long average waiting time, such as public hospital, are found to have low level of satisfaction. Next slide, Pak Mulia. Next slide. Sorry. The next slide show more evidence that X group is positively significant to satisfaction. Age less than 30 years, in general, this group has low level of satisfaction by 4%, as evident to age more than 46. Overall, this group has higher level of satisfaction by 6%. This is also supported by those in region 2. Based on this finding, we agree with Perotin et al. 2013 and Hacker et al. 2009 that the older person who more experienced that make them prepare themselves from the beginning so that they will feel satisfied with getting service. Next slide will present it by Pak Mulia.
Okay, ladies and gentlemen, in conclusion, let's sum up the main point, starting with the number one, the quality of health facilities in Java Bali is the highest among other regions, while health facilities quality in Sumatra is the lowest. Number two, nurse or midwife and private physician have the highest patient satisfaction, while the satisfaction level toward public hospital is the lower compared to other types of facility. Number three, factor that determine patient satisfaction is waiting time. Longer patients wait, the lower satisfaction. Number four, satisfaction in influenced by the age variable because age patients tend to report satisfaction as they have had more experience with the facility. The last slide, waiting time is one determinant of patient satisfaction. The shorter waiting time, the more likely satisfaction increases. So to increase patient satisfaction, health facilities should hasten service delivery, especially for the patient aged 30 years or under. Thank you.
Yeah, thank you.
Time's yours, Dewi.
Yeah, thank you, Pak. Very interesting findings. So now we move to the next agenda. Professor Bernadette Robiani from Sriwijaya University will be act as our discussion. Ibu Bernadette, time and place are yours to discuss our book, Ibu.
Thank you very much, Ibu Dewi. First of all, I would like to give my high appreciation to the Indonesia Regional Science Association for publishing this book. And then I also like to give a very high appreciation to all the authors in each chapter of this book and also the editor of this book. As Prof. Ansori mentioned in his foreword, I really enjoy reading this book, and I'm pleased with the articles and research results this book had presented. And then
I think, in my opinion, this book carries carries a crucial message, and in my opinion, it is somehow served as an early warning for the current condition of the COVID-19 pandemic. As we know that this book is this come from our last IRSA conference in 2019 in Banda Aceh, yeah, and but somehow it, in my opinion, it predicts, what it predicts, and it really linked with this pandemic COVID right now. Articles in disaster chapter. I will not discuss about all the chapter. I only will discuss about 3 of the chapter in this book. And then the first chapter about disaster chapter, for in my opinion, this is tell and remind us that a country such as Indonesia which is prone to the natural disaster need I think an adequate insurance system. And then in this book, in this chapter also explain us with the insurance system, it will capable to finance physical reconstruction due to the disaster. And also from the disaster chapter, it also tell us and remind us that we need an effective mental health recovery program. I think especially after the pandemic, maybe the government and also the private sector need to do the research relate to or according to the mental health of Indonesia people. And then the second things related to the regional development. I think this book provides insight for local government, where the local government not only rely on the natural resources, but need to see the other sectors such as tourism, that we know that it can absorb more labors and also give more multiplier effect, and also may increase the local revenue. And then I think these articles, this chapter, also we can also relate it with our condition right now, as we know that the tourism sector is one sector that has a negative impact, a very negative impact from the pandemic. And then it means that I think this chapter remind us to maybe after the pandemic to see to explore more about this sector. And then the third one, I think this book provide critiques on the dismal role of the national health system, our national health system. And then I think we have to be honest that we still need to improving our national system. We still need to improving people's overall health. And then I think based on this result, we can imagine how the performance, our government performance to overcome this pandemic right now. So I think I believe this book should be read not only by the academics, the academician, but also by the decision makers as stakeholders to become a reference in making decision in the next, especially after the pandemic. And then I absolutely agree with Prof. Ansori because this book really has a very high quality articles, and then also a very valuable result. I think this the thing that I can share for my opinion about this book, Ibu Cut Dewi. Terima kasih.
Yeah, terima kasih Ibu Bernadette. Very kind words from you, and also that such encouraging others as well. So I completely agree with you as well that this book can be used as a reflection of before we have like natural disaster. Now we have like health disasters. So where the health system in Indonesia is really challenged by the COVID-19
Yeah.
pandemic. Okay,
Yes.
thank
Yeah.
you. Yeah, so now we move to Q&A agenda section. I can see that Bapak Insinyur Gunung from PSPPR UJM has raised his hand.
Sorry, no.
Silakan Bapak. You have a question? Please introduce yourself first. I think so we can know you from where.
Sorry.
Let me see. Turn on your video. No. Okay. Do you have a question, Pak? Pak Gunung Regiman?
I think Pak Gunung said that it's accidental. He's sorry. He's not asking a question.
Oh, okay. I can hear him. Yeah. Okay.
Yeah.
Is there any other question from participants? If not, I will take my privilege as a moderator. Oh, okay. Pak Nazam. Yes. Please, Pak Nazam. Yes.
Okay.
Can you hear me, Pak?
Yeah, okay. I just would like to know the response from the presenters of both papers. Yeah, the first paper talked about the quality of health facilities. But my question is on the quantity. You know, in the light of this current pandemic, what would you suggest to the governments, including the local governments, in terms of providing or improving the capacity of the hospitals to face this kind of pandemic in the future? You know, we know that a lot of problems, a lot of complaints about the facilities and the capacity of the hospitals, local hospitals especially, in the light of this pandemic. But you know, very little is done to respond to the shortcomings. What would you suggest to the governments, including the local governments, in this thing? Thank you.
Yeah, thank you. So this question for the second paper, right? Okay, I think I will collect three.
I think both papers.
Oh, okay.
Both papers.
Yeah. Okay, I think I will collect three questions first before you can answer. We move to Ibu Sylvia Agustina. Can you hear me, Ibu?
Ya. Assalamualaikum warahmatullahi wabarakatuh. Can you hear me, Bu Dewi?
Yes, I can hear you. Yes.
I missed the first presentation, but I'm quite interested in the result of the second presentation about health patient satisfaction. So I would like to hear a perspective from researcher about the relationship between waiting time. So the one of the factors that has high influence is the waiting time. So the less waiting, then the patient would have higher satisfaction. So I would like to hear their take on the relationship between this health delivery service with the urban fabric, the city fabric. because I will give one illustration about the situation in Banda Aceh. Because health facilities are not willing to invest in how they manage patient incoming. So there are no phone appointments, so they will just let people wait for a long time. And then the impact to the street nearby in the nearby area, like there are a lot of parking space. Cars are parking like maybe a kilometer, probably more. And these are all actually can be solved by improving how they take in the patient. So I'm wondering if they are actually looking at this relationship in their research. So not only um, from the factors that are already in the database that they are using, but also looking at how actually poor delivery health services actually has a long uh, impact beyond only satisfaction. So I hope I make myself clear. Actually, if the chat room is open, then probably I can also type.
Yeah, okay. Thank you, Bu Sophia.
Can you hear me clearly?
Yeah, I think your question is about the relationship between uh, waiting time, that's how like health delivery system, and urban fabric, how that's affected each other, yeah, Ibu Sophia, yeah?
Okay. Thank
Yeah.
you.
Yeah, thank you. So we move to the third question from Professor Budi. Pak Budi, can you hear me, Pak?
Thank you very much. So my question is for Bu Diana, Pak Catur, and team. So based on your research on mental health and and some of the discussion on the effect of disaster on mental health, can you describe what will happen with us during this COVID pandemic? What kind of mental health issue that would come up, and which one that actually could be can stand more due to this COVID comparing to some others. So great if you could describe what we going to face and what are needed to be able to soften the mental health effect due to this COVID-19 pandemic. Thank you.
Thank you, Pak Budi, for the interesting questions. So now we move to the answer question section. Who will going to answer first? Ibu Diana and friends, or Pak Mulia and friends? Ibu Diana, do you have problem, or you want to answer first? Oh, okay.
Let me start.
Yeah.
Yeah. I will respond to Pak Nazam question related to the availability of health facility, I guess. Well, this is very much related to uh, paper number 2, but and then he mentioned that we also allowed to answer. Okay. When the pandemics shock come, and we experience in Jogja that the scarcity of the personal protective equipment is really matter. Even we asked to one or two hospital and they didn't have any, especially for the local health facility. That's amazing. Okay. Number 2, when we in a group, by Sonjo try to help them, the procedure to help them is not really easy. There is a bureaucracy that we have to entangle with. So we cannot, give some, facility to hospital at the beginning of that situation. And then we found also that there is no link between one hospital with another. So it seems to us that there is no communication between one and another. So that's that kind of lack that we encountered during the early stages of the pandemic. Okay. And for the question from Pak Budi, I think Budiana better can answer the question, because Budiana is a psychologist, so you can unmute, Bu Diana.
Okay. Iya. Thank you, Pak.
Maaf tadi mute. Ya, oke. Sekarang bisa didengar ya?
Ya, bisa Ibu. Ya, we can hear you.
Halo. Ya. So what will happen with pandemic, as this pandemic situation is also kind of disaster. So the trend will be similar. So in terms of mental health problem, we are facing this pandemic now is maybe only increase a bit, like the number of the people who suffering from mental health problem only increasing a bit, like what WHO always predicted in the disaster context. But the long term, the mid and long term effect need to be anticipated. So as I mentioned before, due to the poverty, due to the changing situation, due to the online school, which is some of the family not really ready to back up the student to deliver the online learning, as well as the school not really ready to do it. So we expected long-term effect of that is in terms of what Prof. Catur said, need very much coordination between one policy and the others to make the well-being of the people better. For example, now some offices making kind of policy that everyone need to be at the office every day, while the school is still closed. So that's make confusion, make the children left behind, make the student is not really good. So and as well as the policy in the economics, I think make the people also not easy to be to be managed because of the economic, because of the government not really prioritize or not having insufficient support on that. So but in the level of individual and family, we need to strengthen family, and we need to strengthen people to educate the mental health literacy, so the effect will be not long term. That's the anticipated things that we need to do. Yeah.
Thank you, Bu
Thank
Diana.
you.
So education is also the key, one of the key, like you mentioned before. Like, and then we move to Pak Mulia and friends. Do you want to answer the first question first? I think from Pak Nazam, so it can.
I think answer this question about waiting time, Bu.
Oh yeah, okay. Oh, what waiting time, not the increasing hospital and pandemic. Hospital satisfaction and pandemic. Or you jump to the second question. That's okay, Pak.
Yes.
Yeah.
First question maybe.
Okay.
Okay.
First question, Pak Amir.
Yeah, I think in our paper we have explained that my government hospital have a low patient satisfaction. The government must upgrade their facilities. This is especially influenced during the pandemic. Moreover, government hospital are the facilities appointed by the government to accommodate people who have the contract the virus. So, and then the second question, my opinion, I think in my area or all the area in Indonesia to get health service have to wait more than 30 minutes, and I think it's happened not in my area. All area are affected, especially government hospital or puskesmas. Maybe Pak Edy will give.
Okay. Thank you, Pak Amir. I try to answer this question, relationship between waiting time and satisfaction. I think this is the true, because if we will going to the facilities, health facilities, and only less minutes waiting time, so and we receive receive service and then finish, and then we go to home. It is very fast. I think it's very fast satisfaction. And then this application in this less fit, less waiting time, we can, the application is the take at in this morning, and then so we can wait in this home and come direct to this service. And then number two is this application is telephone appointment too. I think this application from this waiting time, I think this is my answer.
Thank you, Pak Edy. So we use like online or through phone appointment, yeah, so reduce the waiting time.
Yes.
And then I think you answered Bu Sylvia question. I hope Bu Sylvia is satisfied. And then the third question from Pak Budi. I think this also to both of you. What will happen during the COVID-19 pandemic with our health system? Who going to answer this question? Pak Edy already off. Pak Amir?
I have experience in Jakarta, and I look people in here is scared because many people know that government is not ready to face the pandemic. So from the situation, we can know that the government, I think the health service from government is not enough now. Maybe after the pandemic, government can increase this. Okay.
Okay, so our government, even not pandemic, they are not ready. No, they get more not ready. That's what you're saying, I think. So our government should learn a lot from this pandemic. But to me, they should learn before that. So yeah. I think pandemic like COVID-19 also show how strong the strength of our health system as well. It reflects how like our health system are working. I think all of you have answered the questions. I hope all satisfied with the answers. Now we move to another question from Pak Farhan Helmi. Can you hear me, Pak Farhan?
Hi. Hi.
Yeah, Pak, please introduce yourself first.
So, my name is Farhan Helmi. I'm from the Tamrin School of Climate Change and Sustainability. It's very interesting to listen to the first presentations, how to relate the research relate the disaster and the disability. My question is that what is the status now of the people of disabilities? That also, how to say, as a result of the disaster 2006, what is the status now in terms of mental health, in terms of any related to the social economy. Second questions, based on the lesson learned of this research, what is the government response to that disaster? Is there any program, for example, for improving the quality of people with disability, or this is just as always in most of disaster, from one disaster to others, there is no lesson learned anymore. Thank you, Bu.
Thank you, Pak. I think this for the first paper for Bu Diana and Prof. Catur about the status, like what the status of disability mental health now, and then what the current response from the government to tackle these issues.
Yeah, Pak Prof. Catur first.
No, but Diana, I don't have the data on that. Maybe you have. Yeah.
Yeah. So you mean the status of the disability for the pandemic? Yeah, Bu Dewi, the question is like that.
I think that Pak Farhan wants to know the status of this after now. I think can be also during the pandemic and also before, not only after the earthquake 2006. And then what the government responds to that issue.
Yeah, I think I just to clarify. I think the status of the impact of disaster in 2006 to the people who is now become a disabled people. So what happened with this survivor from the disaster in 2006? So, for example, in 2000, before 2006, they have a good job, but then they lost. And then what happened with now in terms of mental health and so on? In some, I read the report, for example, there's some of how they decided to suicide, for example, suicide because they are depressed and so on and so forth. So I think perhaps it's not really related to the COVID-19, but to see what is the status of these people. Thank you, Bu.
Yeah, thank you, Pak Farhan. Very good question. But I never come across to that kind of research, like how this kind of longitudinal research, I think, need to be done to trace the status of the people with disability. That's I think that's make a new idea for our research, I think. That's what we also write down in the paper, that we lack of the research that having kind of longitudinal tracing for that kind of impact of disaster. But I guess it is very depend on how the support from the environment and also the government, as well as very depends on the resiliency of the people. Some of the general research on Bantul is that the people impacted from disaster recover more quickly than those who from other region, I mean other disaster in other countries, things like that. So the analysis is one paper that produced by my colleague in Faculty of Psychology is because of the philosophy of Nrimo. Javanese Nrimo is, what is Nrimo in English? Nrimo is, I don't know what is Nrimo in English. Kind of acceptance, kind of acceptance, the high acceptance due to the Javanese values and Islamic values. That's so we guess that it is only guessing that maybe they are become more resilient based on that paper, that research, but not specifically the status of people with disability after the pandemic. And it is the risk of suicide indeed increase because of if the environment is not really giving good support for rehabilitation. So what need to be done to recover the people like this is making this person adapt to the new disabilities and giving them kind of meaningful work or meaningful activities, daily activities. That's what I'm thinking. Thank you.
Prof. Catur, can you hear me?
Yes. Could you repeat?
Do you want to add more what
Oh,
Diana has explained?
yeah. I'm sorry. There was a bakso Malang come across in front of my house, so I have to.
Bakso is
Yeah. I just just want to add that when we come to visit to Bantul, like 3 or 4 years after the disaster, we don't believe that there was a disaster over there. So the development over there is really very fast. Even now, we don't have any, signs that there was a disaster. And there was also a Marapi eruption back in 2010. It seems that people uh, uh, easily forget that event, I would say. So they have very high activity around Marapi Mountain. Even they have off road activities for the tourism and so on. So it seems that the recovery process is very fast. And we hope that with that very high activity, those who are affected, the disabled person and so on, will be taken care of by that activities. But again, we don't have any long-term observation on that. Maybe this is our lack of information that we have. Okay, thank you, Dewi.
Yeah, the discussion how has directed us to go. Like we now talking about how like easy people to forget disaster, and then how like probably the forthcoming disaster will be happen. So it's like between forgetting and this resilience, like the easier you forget, probably you can move on and then you get resilience. But forgetting can also cause a fatality in the future disaster, like in Aceh, for example. If like you forget about the tsunami, you won't pass the stories of the tsunami to future generations, and they don't know about the tsunami, and then they don't prepare. So that's really mixed balance. How like to forget and to remember. That's very interesting. I think we answer all the questions. We talk to a lot of issues today. So now come to the end of our lunch. I would like to thank all of you who has make your way here to the virtual meeting room of FKP. And thank you, Lydia. Thank you for NU Indonesian project, IFAD, and all the editors and all the writers. So I think the taking home message from this food lunch is like, firstly, the disaster not only to be resilient to disaster, not only the responsible of the government, but also us. We can see like from the first paper that Diana presented that not only health system should be improved, but also how the family and the education are taking part in the disaster resilience and how like we prepare for disaster. Probably COVID-19 is another disaster that really unforeseen before, and it's suddenly like beyond what we have prepared so far. We always prepare for natural disaster. We forget about like health disaster. So the two papers today focus on our health system that's still very weak and need to be strengthened in the future, because how we tackle the pandemic really affect our health system. So thank you so much. And I think Nadia shared the screen where to get the book. Can you do that again, Ibu? Okay. So for those of you who want to get the book, you can like, yeah, sorry, it closed. Oh, okay. That's the cost is 100,000. For those who like to have, you can contact Pak Herialdi from UNPAD. You can see here. So I would like to conclude by saying like, let's prepare for disaster, even the disaster that you don't expect. So thank you so much, everyone. Thank you. So I will return the session to the floor to Bu Lydia as a host.
Thank you, Ibu Dewi. I have just unmuted everyone. Thank you, everyone, for coming to today's FKP. If you would like to say hi to your friends or others, we hope you can join other FKP meetings in the future. Please check our website, www.fkpindonesia.org, for the schedules. We have 4 more events this month. That's all for me. Thank you very much, all the speakers, Pak Ibu Cut Dewi, Pak Arief, Pak Mulia, and everyone. Pak Amir.
Untuk Lid boleh kasih pengumuman sedikit, Lid?
Yeah, go ahead, Mas Budi.
Yeah,
Silakan.
untuk
The event is closed ya. Gali, can you just stop the video for the YouTube, please? Thank you.